Hey, it's Kirsten, just doing the Ethics of Diversity assignment video. So the assignment is to talk about the ways that medical providers and students can experience bias, both implicit and explicit. And the areas that we talked about in class are all the same areas that you can experience these biases, including religious, sexual bias, racial bias, and bias against those with disabilities. Through the readings in the course and just reading the different posts from classmates, it's obvious that medical providers and students can have bias, both explicit, which is more of our conscious attitudes and beliefs that we're aware of, whereas implicit bias is more an unconscious belief that we're not really aware of, but can definitely influence our decision-making and behaviors. And then just going through the different types of bias and analyzing them. We can have religious bias, and that can be a problem in several areas. Patients may feel belittled or misunderstood because of their beliefs. Many Native American individuals feel this because they have different spiritual practices and ceremonies that maybe Western doctors and medical students don't really understand. But then also, I think providers can definitely have some misunderstandings and difficulties in understanding individuals like Jehovah's Witnesses who are very adamant about their beliefs, and they might even choose death over getting, for instance, blood transfusions. I also think that in talking about sexual practices and beliefs, that can definitely be an area of concern with providers or patients. Providers might not really have an understanding of different sexual practices, and they might have their own implicit bias about sexuality, and that might come across when getting a sexual history and a patient says that they are into, different sexual practices like anal sex or oral sex or maybe BDSM, and providers may not know how to react to that, and it might come across in their interactions. I think also a lot of patients may not really want to disclose that maybe they're polyamorous or their different beliefs just because of the fear that they're going to be discriminated against. And then when it comes to disability biases in medicine, I think that can be in a lot of different ways. The clinic itself might not be the greatest or equipped to deal with those who maybe need wheelchair access or ASL interpreters, and those individuals might feel a lot of bias and not even seek out medical care because it's very hard for them to get into a clinic. But I think also providers and even myself in rotations can find it frustrating when patients maybe have hearing difficulties that you're unaware of or just communication difficulties, and trying to ensure that you give the best care but try to maintain not being frustrated in front of the patient. That can be hard at times. And then the last sort of area that we discussed in class was racial bias. And again, this can happen in many different areas. There's many different races and each has their own culture. And I don't think as healthcare providers we're taught that well about how to interact with the different cultures and how they can they can be very important to patients and how they decide on their medical care and their health in general. And I think that we as medical providers can unfortunately think about stereotypes and then stereotype our patients and just make wrong assumptions when it comes to patient care. So I think that's something that I think medicine in general needs to work on, and educating medical providers in better ways to interact with patients of different races. Then the second part of the assignment was to kind of identify the intersection of personal beliefs and the practice of medicine. I think that the main concern is that you might have negative personal beliefs regarding different areas of bias, and this might make you not give the standard level of care for each patient. But I also think that positive personal bias can also just be as detrimental to patient care. You might assume that a patient who is, say, white and middle-aged woman, she maybe doesn't need STD screenings because you're assuming that she's in a monogamous relationship and doesn't engage in risky sexual behavior, and that might be completely wrong, and you're not giving her the same level of care as you would maybe someone else that you would assume would be more promiscuous. And even with negative, you might over-screen someone or under-screen someone, and that's why it's really important to just maintain a standard level of care and stick to the guidelines and not stereotype patients at all. And then the last area of the assignment was to kind of think of ways that you can ensure and make a plan of how you can give the standard level of care to everybody. And I think it's important to recognize implicit bias. I really enjoyed that in class. It brought up areas that I wasn't aware of, but now when I'm interacting with patients in clinic, I'm really thinking, am I being biased here? Is there an implicit bias? Do I need to kind of evaluate the whole situation though, so that I'm providing the best level of care to this patient? And I think it's important to seek out CMEs and different research as I go forward with my career to kind of understand different cultures and races, sexuality, disability, especially wherever I work. If there is maybe a certain culture that's there, or we see a lot of the same race or whatnot, then it's important to research them so that you kind of have an understanding, so you can give them the best care that you are able to. So I think all of those are really important, and it's been, I think, a really good course. I think this should honestly be more incorporated throughout the whole didactic year and not just over the last 6 weeks. It's been kind of eye-opening and super helpful in challenging the way that I think about certain things, and really just exploring my own thoughts and beliefs as a future medical provider. So it's been really fun to go over all of this, and I definitely think I'll take it into practice with me and just ensure that everyone that I'm interacting with does get the same level of care and challenge my own biases as I go. So thanks.